close is a relative word. So we have no FDA-approved therapy for EGIDs. Yet that's never stopped pediatricians, because most of the drugs that are available to treat anything haven't been approved for children. So we use them despite lack of an FDA support for the, or label for them. What that really creates for us is difficulty with insurance companies in getting these things covered. But that being said, there are a number of studies in their late phase of development that are looking at what we currently use, and essentially what's available now for treating, for example, eosinophilic esophagitis, are asthma medicines that we tell patients to take differently. So instead of inhaling fluticasone, we ask them to swallow it. Instead of inhaling Pulmicort, which is budesonide, we ask them to mix it up in something sticky like Splenda or honey and swallow it. On the horizon, there are a number of companies that are working on these orphan diseases like EGIDs to provide a vehicle by which the patient can take the drug in some standardized form. So that's both for fluticasone, for budesonide. There are drugs that are in development now that will be a standardized pill or dissolvable tablet that a patient can take rather than having to mix up an asthma medicine and use it in some type of alternative form. I think I'll make it much easier for the administration of some of these drugs. And then on the horizon are a number of drugs that are biologic in nature. So they're antibodies against some of the factors that we think are really important in driving this disease. Some of those would include anti-IL-5, which has already been tried in clinical studies, anti-IL-4 receptor antibodies, which show a great promise in a number of allergic diseases. And so there are things that are on the horizon that, depending on their results in the later stages of studies, will be coming up to the FDA for approval, and we're very hopeful that this will offer additional options to our patients.